You are here because you are tired. You have been treated like a series of parts on a medical industrial assembly line. You have been told your pain is a diagnosis. You have been given pills to numb the signal and injections to grease the squeaky wheels of your joints. And yet the pain remains. It might be quieter for a few weeks, but it always returns. Why? Because the system is not designed to fix you. It is designed to manage you. It is designed for the efficiency of the insurer and the profit of the manufacturer, not for your restoration. I am Dr. Gurpreet Padda. I have spent over 30 years in the trenches of anesthesiology, addiction, and interventional pain. I am here to tell you a physiological truth that the system is afraid to admit. Your pain is not the problem. Your pain is the signal. Traditional medicine is built on a reductionist organ-centric paradigm. If your back hurts, they look at the disc. If your knee hurts, they look at the cartilage. This is the failure of the biomedical model. It treats the human body like a static machine rather than a complex adaptive system. In the assembly line model, you are a code. You are a CPT code for an injection or a prescription. This model is stagnant. It ignores the confluence of the three great epidemics of our time, and the opioid epidemic, the nutritional epidemic, and the diabetes epidemic. They are not separate issues. They are three heads of the same monster. Most pain management centers perform procedures simply because insurance allows them. They provide endless injections without a clear diagnosis of the underlying terrain. This is why you have failed. You cannot fix a systemic fire by only spraying water on the smoke. At the Padda Institute, we view pain as a biological data point. It is your body screaming that something in your structure, your metabolism, your nervous system, or your lifestyle has drifted out of balance. Pain is the final pathway. It is the messenger. When we ignore the messenger, we allow the underlying disease to rot the foundation. Consider the high-stakes reality of our current health landscape. Only 12% of American adults are metabolically healthy. That means 88% of you are living in a state of biological distress. This distress manifests as chronic pain. We are not interested in numbing you. We are interested in identifying the signal with mathematical precision and intervening intelligently. We do not believe in the medicalization of symptoms. We believe in the restoration of function. The true cause of your chronic pain is likely something we call meta-inflammation. This is a chronic, low-grade inflammatory state driven by metabolic dysregulation. It is the result of a toxic environment and a hijacked dopamine system. Big food and big pharma profit when you stay sick. They bombard you with ultra-processed foods designed to trigger insulin resistance, and then they sell you drugs to manage the damage. When your insulin levels are chronically high, your body cannot heal. Your mitochondria, the engines of your cells, become dysfunctional. This leads to oxidative stress. This leads to a nervous system that is stuck in a state of high alert. This is the terrain that allows pain to become chronic. If we do not fix your metabolic health, your sleep, your movement, and your nervous system regulation, no injection in the world will provide sustainable relief. Consider the molecular competition happening inside you. When you are hyperinsulinemic, your brain is too busy breaking down excess insulin to clear out the toxic proteins that lead to cognitive decline and chronic neuroinflammation. Your immune cells in your spinal cord, which we call microglia, undergo a metabolic reprogramming. They start competing with your neurons for energy. This competition drives the transition from acute pain to a permanent chronic state. You are not weak. You are not imagining your symptoms. You are suffering from a systemic energy crisis. The assembly line model will never tell you this because you cannot put a high profit margin on a lifestyle intervention that returns sovereignty to the patient. Let me offer a contrarian view. There are many in my field who would say that what I am telling you is too complex for a patient. They say just give them the shot and send them home. They believe you are incapable of taking responsibility for your own biochemistry. I disagree. I believe that once you understand the economic and physiological truths of your condition, you become the most powerful agent in your own recovery. However, I must also be honest, our approach is not for everyone. If you are looking for a magic pill that allows you to continue a lifestyle of metabolic suicide, we are not the right fit for you. We reject the safe corporate appearance of modern medicine. We are a living laboratory. We use data-driven outcomes and MBA-level efficiency to re-engineer your health. This requires your participation. It requires a rejection of the assembly line and an embrace of radical personal responsibility. Our mission is to return metabolic sovereignty to the individual. We use advanced health assessments to give you real-time insights into your autonomic function and your metabolic health. We use physician-led data-driven protocols to identify the intersection of your pain and your metabolism. We practice modern interventional pain management, but we use it as a bridge to allow you to do the hard work of fixing the underlying terrain. We treat at the intersection of the pain epidemic and the metabolic crisis because they are the same pathology. We are the Padda Institute. We believe that the health of the individual is the fundamental unit of the health of the community. We expose misaligned incentives and return the power of health to the individual. We believe empowered individuals change their communities. Think about the world around you. We live in a society designed for convenience, but the price of that convenience is your health. We are fed processed foods that are shelf-stable but biologically toxic. We are given social media connectedness that creates a false paradigm of human interaction, leaving us in silos of loneliness. This loneliness drives a search for hedonic substitution, where we seek comfort in food or substances to numb the biological pain of isolation. It is a cycle that keeps you dependent and profitable for the system. We want to break that cycle. We want to help you exit the cage. When you walk into our center, you are entering a space where data is king. We do not guess, we measure. We look at your insulin markers. We look at your inflammatory markers. We look at the way your nervous system responds to stress. We identify exactly where the signal is coming from. Then we architect a plan that is unique to your biology. This might include orthobiologics to heal damaged tissue. It might include metabolic reprogramming to fix your cellular engines. It will certainly include a shift in how you view your body. We are not just doctors, we are architects of restoration. You have likely tried everything. You have done the physical therapy, you have seen the specialists, you have taken the medications, and you are still in pain. It is not because you are broken beyond repair, it is because they were looking at the wrong map. They were focused on the bone and the muscle while ignoring the chemical soup those structures are sitting in. If your blood is filled with sugar and your cells are filled with waste, your tissues cannot regenerate. It is as simple and as complex as that. We provide the tools to clean the environment so the healing can finally begin. The flames are already licking the foundations of our healthcare system. Barely 1 American in 8 still meets the definition of metabolically healthy. The bill for this failure is now well over $2 trillion per year. We are heading toward a structural collapse. But you do not have to go down with the ship. You can choose a different path. You can choose to listen to the signal. You can choose to stop the assembly line. You can choose to reclaim your sovereignty. If you are ready to stop being a part on an assembly line and start being the architect of your own health, click the link below. Book a call, get the data, reclaim your sovereignty. Let us identify the signal and fix the terrain. The flames are already licking the foundations. Do not let your health burn with it. Connect with us today. We are the Padda Institute, and we are here to bring you back to balance. This is the end of management and the beginning of your restoration. Take the first step. The power is yours.